Namaskar. You are watching Dr. KK Med Talks Fridays with Dr. Anita Kant, non-stop 885th episode. Let's have the headlines of the day. Statistics show that 37% of Indian women aged between 20 and 40 and 57 of those in the 40 to 59 age group have fibroids. A study from Northwestern University published in PNAS has demonstrated that environmental chemicals such as phthalates and parabens may increase the fibroid risk. In a recent study published in the journal Nutrients, researchers at Johns Hopkins Medicine reviewed the beneficial properties of green tea in alleviating symptoms of benign gynecological disorders. The Ohio State University Wexner Medical Center are offering a minimally invasive procedure to give women a simpler option to relieve uterine fibroid symptoms without having to undergo a hysterectomy. Trenilast, a drug used to treat allergies and certain types of scars, reduced the size of human fibroid tumors implanted in mice according to a NIH-funded study. So now let us go to the topic of the day. Today we will be talking about fibroids of the uterus. So to tell us about uterine fibroids, we have our special guest, Dr. C. Sharath Kumar. Welcome, sir.
Hello, good evening, madam. How are
Good
you?
evening. Good.
Very happy to see you.
Thank you. Dr.
Yeah,
C. Sharath Kumar,
you moderate in such a nice way. It's easy for any
thank you.
speaker to pick up the subject and complete it.
Thank
And
you.
you
Thank
give
you
the
so
link
much.
so easily that anybody can just go through the subject very easily. Yeah. Thank you
Thank
very
you.
much,
Thank
madam.
you.
Yeah.
Thank you. Let me introduce Dr. C. Sharath Kumar. He holds the esteemed positions of principal, professor, and head of the Department of Reproductive Medicine and Surgery at the renowned Mediwave Institute of Medical Sciences in Mysore. With an exceptional educational background and a remarkable track record, he has garnered immense success throughout his career. Driven by his passion for mentoring, he has guided numerous students and played a pivotal role in elevating the institute to unprecedented heights of accomplishment. His dedication and expertise continue to inspire and shape the future of medical education and research in the field of reproductive medicine and surgery. So, we are proud to have him here. And today we will be talking about fibroids in the uterus. So, to begin with, sir, what are these uterine fibroids and how common are they?
Thank you very much, madam, for such a nice introduction. I don't think I deserve all those
You
prizing
do,
and
you do.
adjective words. Thank you very much. Of course, I am in this subject from past 40 years, practicing infertility and, of course, gynecology also and male infertility in particular. Thank you very much for the nice introduction. Today's subject is very, very interesting. Not only interesting, it is very, very important because I see so many hysterectomies being done, especially after the age of 40. And most of them, they wouldn't have undergone if they would have been properly diagnosed and properly explained and proper counseling would have been done. And in some of the areas, especially with the advent of these insurance companies, there is a certain, I am very unhappy to say this one, certain unholy alliance between the insurance companies and the some of the gynecologists. I am not telling all the gynecologists. They simply, one scanning, a small fibroid found out, 40 years plus, she has got two children. Yes, take her for hysterectomy. Even without analyzing what would happen if an unnecessary hysterectomy is done, what are the post-operative complications of the hysterectomy, and what were the signs and symptoms? Was it really necessary to do an hysterectomy? So I'm very unhappy to say that, but we have to bell the cat. Somebody has to bell the cat. I am taking that responsibility of the belling the cat. So fibroid uterus is a very common, as Madam already told, about 30 to 80% of the women in some areas after the age of 40, they have one or the other fibroid in the uterus. And most of them would have been found out incidentally when they undergo for scanning of the pelvic scanning due to some other reason, maybe some dysmenorrhea or some hemorrhage or bleeding disorders or infertility or something. They would have undergone for something, and incidentally, the sonologist reports that there is a fibroid. And these fibroids are technically called as leiomyoma. And these leiomyomas are classified as uterine myoma, and there are so many types, so many other synonyms, fibromyoma or fibroleiomyoma. These are the pathological terms used, but all in common terms are called as fibroid uterus. And there are so many types of fibroid uterus. There is subseral fibroids, intramural fibroid, submucosal fibroid, pedunculated fibroid, cervical fibroid, and fibroid of the broad ligament of the uterus. So these are classified into different types depending upon the position of the fibroid. And they can also be classified as single fibroid, as multiple fibroids, depending upon the number of fibroids. So, madam, before going to the treatment, proper diagnosis and proper location, how many fibroids are there, where they are there, then only we have to go for the treatment aspect. Over to you, madam.
So, what are the symptoms of these uterine fibroids?
Yeah, we have a very important question, madam. The symptoms may be 50% of the leiomyomas, that is fibroids, are asymptomatic. They don't have any symptom. A lady would have come for something else. She has got some little pain abdomen, some backache, and routinely the gynecologist would have suggested a pelvic scanning, and the very intelligent sonologist picks up a small fibroid, 1.5 centimeters into 2 centimeters fibroid uterus. Oh, that makes a very big fuss. Oh, fibroid uterus, fibroid is there, and it can grow and it can become leiomyosarcoma. It can convert into cancer, and she lands up in hysterectomy. So the symptoms are many times they're asymptomatic, and some may give low backache, some pelvic pain, dysmenorrhea, and some may have bleeding and bleeding disorders, and some even painful bleeding during the menstrual cycle, and even very few patients may land up with infertility. So those would have gone for the infertility treatment, they would have gone, and it would have been picked up during this one. And heavy periods, menorrhagia, metromenorrhagia, that is bleeding continues for more than 5 days. Metromenorrhagia, that is pain during the menstrual cycle, and heavy clots, and continuous bleeding even without break, that is bleeding throughout the periods. So these are the severe symptoms. So the symptoms depend upon where the fibroid is. Subseral fibroids, they hardly do any symptoms. They are most of the time asymptomatic. Even broad ligaments fibroids, they may not give any symptoms except little pelvic pain sometimes. But the fibroids which are in the intramural, they may give dysmenorrhea. And subserous, the submucosal, they bleed, and some of them they may bleed heavily. So symptoms depend upon the position of the fibroid, number of the fibroids, size of the fibroids, and all these depends upon so many other factors also. So to make proper diagnosis, one has to do intravaginal scanning, transvaginal scanning, find out the location of the uterus, find out the size of the uterus, size of the fibroid, and how many fibroids are there. Are they really linked with the symptoms the lady is telling? And some of the submucous fibroids, they may lead the lady into infertility because it comes in the way of the implantation, because it is occupying the place of the endometrium itself, that is the cavity of the uterus itself. So the symptoms vary from lady to lady, right from asymptomatic up to the landing up her in infertility, they vary. But the commonest symptom is dysmenorrhea and menorrhagia.
So now what happens is that once a lady is diagnosed
Yeah,
to be having fibroids, the
yeah,
first thing that she gets scared is that they will become cancerous. And she
yeah,
runs
yeah,
to a doctor. And it is
yes,
difficult to convince them that these
yeah,
are not going to be cancerous right now. And what is the
yes.
possibility of cancer in future? Please tell us about it.
Yeah, madam, this with the advent of this marketing in the field of medicine, I am very sorry to tell. So what happens is, especially when they land up in multinational company hospitals where the gynecologist will be asked to get the number of surgeries in a month, in a week. So she'll be low, she'll be under pressure to get the patient recruited for surgeries. So what she or he will do is they will exaggerate the possibility of the cancer. Of course, any uterine fibroid or, for example, any benign tumor anywhere in the body, it can get converted into a cancer. That I agree. But what is the possibility? Maybe 1 to 5%. It doesn't mean that all the fibroid uterus are there. They should be removed. They can be kept under observation. So the possibility of a leiomyoma getting converted into a leiomyocarcinoma is there, but it is only 1 to 5%. Though most of these tumors, they have to be kept under observation. Of course, a very large fibroid coming in the way of the implantation of this one, large fibroid pressing the urinary bladder, making her inconvenient to pass the urine, frequency of urine, pressure effect over the urinary bladder, and severe pain, this severe dysmenorrhea, those people have to be taken for surgery. Otherwise, just because there is a fibroid, it can be kept under observation, and most of these fibroids, especially after the age of 52.6 years, they regress. Once they pass the age of menopause, most of them, because they are of the hormonal origin, they regress themselves, and asymptomatic fibroids without any problem, and smaller ones, single ones, they need not be taken it seriously because hardly they get converted into leiomyosarcoma. But of course, continuous monitoring, yearly scanning, and looking at the other signs of dysmenorrhea, menorrhagia, metromenorrhagia, they have to be kept in mind. A lady who has got metromenorrhagia, she is the one candidate, is the candidate fit for surgery because the fibroid may undergo leiomyosarcomatous changes, and she may land up in the carcinoma, that is cancer. So, without symptoms, the chances of fibroid getting into cancer are rare.
तो आपने you have told us very nicely. मैं I like to translate in हिंदी. हमारे सुनने वालों को बताना चाहूंगी कि
Yeah,
कैंसर
बताइए
के
मैडम. हाँ,
कैंसर के
because this is
चांसेस
an
बहुत कम
awareness
होते
program,
हैं.
madam.
यस, कैंसर के चांसेस फाइब्रॉइड में डेवलप होने के बहुत कम होते हैं अगर आप नियमित रूप से अपने डॉक्टर को दिखाते रहते हैं, आपको ब्लीडिंग के सिम्टम्स ज्यादा नहीं होते, अल्ट्रासाउंड में फाइब्रॉइड बढ़ता नहीं है, तो चांसेस ऑफ कैंसर बहुत कम है. सर, वी फाइंड on the other hand, as to what you said, as a doctor in a corporate hospital, I find it very difficult to convince these young patients that before 40 taking out a uterus is a crime. A fibroid is
Yes.
not going to turn into a fibroid cancer, and you just keep in touch with us. And बहुत मुश्किल होता है, बहुत मुश्किल. उनके दिमाग में भरा हुआ है because Google Baba is there telling everybody it will turn into cancer. So that is a big problem.
Madam, golden words, madam. I would like to repeat it in English. It's a crime to take out the uterus before 40 if it is asymptomatic. This is
Yes.
Madam Anita Kant telling. I fully endorse in English also. So, if anybody suggests you hysterectomy, please take a second opinion from a senior doctor whom you know very well, a gynecologist, maybe a lady gynecologist, or even a gent gynecologist, a senior one, and who is not working in a corporate hospital. please take a second opinion. I dare to tell this once again. I fully endorse the what Madam told in Hindi, because I'm not that good in telling in Hindi. I'm just repeating in English. Yes, Madam. Please proceed, Madam.
Uh,
Very few people
so
tell
what?
this, Madam.
Yes.
Very few people
So
dare to tell all these
yes,
things. Yeah.
yes. So what are the treatment options for uterine fibroids if not surgery?
Yes, madam. So the first and foremost thing is, if it is asymptomatic, just you need not worry. Just keep her under observation. If there is a pain, dysmenorrhea, low back pain, pelvic pain, just some painkillers, even ibuprofen or a paracetamol. Whenever there is pain, that's enough. Especially the pain will be there during only menstrual cycle. So simple painkillers, just like ibuprofen or even paracetamol, or even a hot fermentation, or little yoga and exercise, or some meditation, or any home medicine to relieve the pain, that is enough. That is, if it is pain. If there is a bleeding tendencies, and just check up the blood. If there is anemia, treat the anemia. And if there is bleeding disorders, just any tablet, that is pause, or any tablet to stop the bleeding, that is enough. That is just to control the bleeding itself. And if there is a menometromeragia, then you may have to start with the cyclical tablets to control the periods and to control the number of days of bleeding. One may start even simple tablets, that is oral contraceptive pills, or progesterone alone tablets, or Dynagest, or progestin tablets, to control the cycle as well as control the bleeding also. So these bleeding disorders, so mefenamic acid will do. And if there is pain also, add mefenamic acid with ibuprofen or some other painkiller tablet. A combination of these mefenamic acid and other tablet, that will take care of the pain as well as the bleeding disorder. Most important thing in the bleeding disorders is, whenever there is a metromenorrhagia or menorrhagia, keep an eye on the hemoglobin level, because if the hemoglobin level goes below a certain level, say something like below 12 or 11, that itself may cause, say, additional bleeding disorders, because the problem with the anemia is that itself is one of the cause for bleeding disorder. So control the hemoglobin level with replacing with iron tablets, or iron injections, or supplements with folic acid, or even with B complex and multiminerals, and zinc, selenium, etc. And these are very, very important, because all these bleeding disorders, that is menorrhagia, may cause severe anemia, landing up in other problems associated with anemia. So controlling the bleeding, controlling the pain, and giving additional tablets to for supplements to compensate what the bleeding has occurred is very important. And if it doesn't come to control, then you can go for the hormone replacement therapy. You can even go for GnRH analogs or antagonists to control the bleeding. That is gonadotrophic hormones. And also, if these things doesn't come to control, then you can go for insertion of the Marina, that is medicated copper T, where there is medication and copper T, that will control the bleeding, as well as there will be contraception also, that can be thought of in the ladies who are sexually active and who doesn't want the children also. For them, this contraceptive device, that will control the bleeding as well as control the possible reproduction also, that is implantation also. So that is important. And these hormone replacement therapy can be taught in those who cannot be controlled with the routine tablets. And other latest drugs like Dynagest, progesterone alone tablets can also be tried. They are cyclical tablets, they can be given. And also depot injections have also come. Progestin injections, they can be given once in month, or once in 2 months, or once in 3 months, depending upon the quantity of the injection available. So they will make the lady amenorrhea, that is, there will be no bleeding at all during this period. So that is the best treatment is giving injection, depot injections.
And
Both.
are there any tablets available to
Yeah, the
decrease the
tablets
size
are
of
also available.
fibroids?
Yeah, yeah. Dynasys tablets are available. They will shrink
Oh.
the fibroid as well as control the bleeding. Injections are also available. Tablets are also available.
So sometimes the patient is very scared that
Yeah,
I got the ultrasound done 6 months
yeah,
back. It was 2 centimeter. Now it is
yeah,
3 centimeter. It is growing. Can it be
yeah.
cancerous? So do these fibroids normally grow during the lifetime of a woman?
Yeah, definitely, madam. The fibroids usually grow, but very slowly. They are benign tumors. And just another thing is, with the ultrasound reports is, there will be about 10 to 20% variation in the size of the fibroid taken from different centers. If you get the same lady scanned in three different centers, and each one would have given 2.2 into 3 centimeter, another 2.5 into 3.5 centimeters, another 3 into 4 centimeters. It all depends upon which angle he has taken and which transducer he has used, and also there is a instrumental error, interpretation error, and also so many things can come to the picture. So if there is only about 10% deviation from one report to another report, that can be taken as within limits. And if it is growing very fast, for example, last month it was 2 into 3 centimeters, now it is 5 into 6 centimeters. Yes, I agree. But with only 1.1 centimeter going into taking into account all these interpretation error, instrumental error, then we have to ignore it. That is called as statistical errors or within limits. Say 10% is within limits. So before coming to conclusion that the fibroid is enlarging, one should take care that very minor deviation need not be taken very seriously. We can wait for another 6 months or 1 year and get it scanned again.
And are there any lifestyle changes which you would like to suggest which
Yeah,
can help?
before that, I would like to answer one more thing. Apart
Yes,
from the surgery, apart from the tablets and injections I told, there is one technique called as uterine artery embolization.
yes.
That is a very good technique, non-surgical, of course surgical, but non-invasive surgery. Just insert the catheter and allow the catheter to enter the uterine artery and embolize it. That is, some pellets are inserted into polypropylene pellets are inserted into the uterine
Yes.
artery. That will the branch of the uterine artery which is serving the fibroid uterus, that will be embolized. That will be chemically blocked. These pellets will go and sit in the uterine artery, the branch of the uterine artery, which is serving the fibroid uterus, and the blood supply to the myoma, that is fibroid uterus, is blocked, and that will shrink very effectively. And also the blood supply to the endometrium is also reduced. So bleeding immediately comes to control. So uterine artery embolization is the best technique. Without removing the uterus, we can control the bleeding as well as shrink the fibroid uterus. And even the entire fibroid entire uterus also starts shrinking, so that she attains menopausal yeah, arena. That is, we are treating the fibroid uterus, menorrhagia, metromenorrhagia, without any surgery. That can be done. And another thing is scrapping the your fibroid uterus if it is submucosal through the trans cervical this one. So we can just introduce this one and cautery machine and remove the fibroid uterus through this hysterectomy. Sorry, hysteroscopy.
Hysteroscope.
Hysteroscopic
Yeah.
removal. Yeah, hysteroscopic removal of this one through cautery, that can be done without removing the uterus itself. So you need not sacrifice the entire uterus. You can just scrap it out through the hysteroscope or embolize it, or through laparoscopy. If it is subseral, just through laparoscopy, you can just take it out without removing the uterus. Or even if it is intramural, selective surgical removal encapsulation of the fibroid can be done by laparoscopic surgery. So one need not sacrifice the entire uterus. One can take out only the lesion which is affecting. So only the entire uterus has to be taken if there are multiple fibroids giving lot of hemorrhage, lot of pain, and she has got already two children. She is 40, 45 plus. Then there is no point in giving keeping the uterus. In such severe cases, then of course the final answer is the myomectomy.
So, without removing the uterus, you can
Yeah.
improve the quality of life of a
Yeah,
woman.
yeah, yeah.
So,
Because doing hysterectomy, it can give rise to other problems, dyspareunia, that is painful intercourse, and she suddenly enters into, she is 40, 42. Suddenly she enters a menopausal age because most of the times, along with the uterus, the ovaries would have been removed. Total oophorectomy and myomectomy would have been done. She suddenly, from 40, she enters the age of 55 biologically because lack of estrogen. So all the and the very fact that she has got her uterus removed itself is a mental trauma to her. She feels deprived, and she has got that guilty feeling that she doesn't have, she is not a lady herself because she doesn't have the uterus, and that itself leads to so many psychological effects. And even she may lose the libido, loss of interest in the sexual activity. Even the partner thinks that, oh, her uterus is removed. She is not fit for intercourse. She is not a complete woman like that. And probably because of the ligation of the vagina, the vaginal depth may decrease to certain extent. That leads to for the male partner, he feels that he is not having the full satisfaction of the intercourse because the vagina is not deep enough, and the lady may also feel that she has got a little sort of inconvenience during the intercourse. So she starts avoiding the intercourse, and the male partner also starts neglecting her. And all these things may give psychological effect, and she may go even for depression. So before hysterectomy, all these things have to be considered. And only lady who has got two children above 40, 45 plus and sexually not so active, they are the best people for surgery.
so what happens to women who are in their postmenopausal time period and they have fibroids?
Yeah,
What should they do?
postmenopausal fibroids, usually they are rare, usually because the estrogen level would have come down, they shrink themselves. And if they are symptomatic only, they need to be removed. If they are in the asymptomatic, they have to be kept under observation so that they won't undergo carcinogenic changes. Otherwise, they themselves, they need not be removed.
And what happens to these fibroids during pregnancy?
Yeah, it again depends upon their position. If it is submucosal, definitely it will come in the way of the continuing the pregnancy, and she may have abortion because two people cannot occupy the same position
Place.
at the same time. So, fibroid which is inside the uterine cavity, that will push the fetus, and it will not allow the fetus to grow for full term, and she may have abortion and recurrent abortions also. And fibroids, that is intramural fibroids, they may cause abortions and they may not cause also. They may live along with the pregnancy. And subseral hardly, and broad ligament fibroids, they hardly come in the way of pregnancy. They need not be taken care. And if she undergoes cesarean due to any other reason, at that time, along with the cesarean, these can also be removed. That is subseral or broad ligament fibroids. They can also be taken at that time. Otherwise, they can be left like that itself.
Thank you, Dr. Sharath. You have really explained in a very normal way that fibroid does not mean doing surgery and removing them. That is so
Yes,
nice of
madam.
you.
And you
Uh,
you told the golden words, madam. That gave me a lot of courage to again declare it, because hardly doctors talk like this, because they'll be always worried about what the colleagues will think and what other things. We have to bell the cat. Somebody has to bell the cat and see this is the thing, so that the common man is not unnecessarily taxed, especially the people who are below the poverty line. They would have spent heavily on these medical expenditures, and it will be a financial trauma for them to undergo, because they have to spend heavily. Sometimes even some of the hospitals, they charge up to even lakhs also for these myomectomies. So they will have financial trauma along with psychological trauma. So it is our responsibility to prevent such unnecessary surgeries, madam.
Thank you. Thank you so much, Dr. Sharath, for joining us today. Could you show us the certificate, please? It's always
Oh,
a
so
pleasure
nice.
to have you with us.
Yes, madam. It's a pleasure to have such a certificate, madam. That too
Thank
with
you.
your signature. I think all our colleagues who have joined today's webinar, they will be very happy. And the
Thank
carry home message is fibroids, of course, they are there. Take care of them, keep an observation on them, try to treat medically, and of course, with minimal invasive surgeries like embolization or hysteroscopic removal. And the final knife should be taken only when all these things are not possible.
Yes. Thank you, Doctor. Keep watching Dr. KK Med Talks. That will all be for today. Dr. KK Med Talks will return tomorrow at 7 p.m. with another edition of the show. Namaste.
Namaste, madam. Good night to you.
Good night.